So Alisertib is an Aurora A kinase inhibitor. Aurora A kinases are very important in the regulation of mitotic progression. And if they're interrupted with targeted therapy, mitotic progression gets interrupted, leads to devastating aneuploidy in terms of mitosis and cell death. So it's an effective way to kill malignant cells. Acute myeloid leukemia, the conventional approach to upfront therapy, has been relatively unchanged for 4 decades. Now, we've seen multiple approvals in the last 2 years, but the upfront treatment for the majority of patients remains the same and remains suboptimal, and that's usually some form of anthracycline and cytarabine-based induction chemotherapy, the most common of which in the United States is 7+3. However, 7+3, as I mentioned, is suboptimal for most patients. Either they don't achieve remission, or if they do, they relapse and progress and die from their disease. This is particularly so for patients who have higher risk AML, and higher risk is generally defined as patients who are older, those patients who have higher risk molecular features such as high-risk cytogenetics or mutations, or those patients who had a prior marrow malignancy from which leukemia developed. So those are sort of these higher risk patients who do even worse than the average patient with AML. We initially did a phase 1 study of induction chemotherapy plus Alisertib across all newly diagnosed patients, excluding favorable risk patients, and found that the combination was well tolerated without a dose-limiting toxicity. And we found a very high rate of remission of over 80%. And especially saw that a high proportion of those patients had higher risk disease. And once we established that the combination was well tolerated in the phase 1, decided to proceed with a phase 2 study, which we are presenting at this year's meeting. This phase 2 study focuses specifically in higher risk patients, those who are older, those who have higher risk molecular features, or those who have antecedent myeloid neoplasms. Again, we found that the combination was well tolerated. We found that the rate of remission was approximately, or composite remission was approximately 64%, which is significantly higher than what would be expected for this high-risk patient population, which is around 45%. And we saw that across the various subtypes of high-risk AML, the high rate of response was preserved. We also found that patients who achieved remission on this study, many of them also cleared their mutational markers of disease, which suggests a depth of remission, which is increasingly sought after with effective treatment of AML. So I believe that these results are quite promising, and our plan is to conduct additional larger studies to further assess the promise of the combination of Alisertib and conventional chemotherapy.